Hi, my name is Kayla Kilpatrick, and I'm doing my presentation on teen pregnancy. Teen or adolescent pregnancy is when a girl or a woman under the age of 20 gets pregnant. I just wanted to start off with some facts to think about before we really get into it. 3 in 10 girls in the United States will get pregnant at least once before they're 20 years old. That's about 750,000 teen pregnancies a year. More than 50% of teen moms never graduate high school. Having a child is also one of the leading reasons that teen girls drop out of school. Less than 2% of teen moms get a college degree by the age of 30, and a teen who is sexually active and does not use birth control has a 90% chance of getting pregnant within a year. In 1957, the record high of teen birth rates was 96 births for every 1,000. There was then a steady decrease in the 1960s, 70s, and 80s. However, birth rates dramatically increased from 1988 to 1991. In 2000, the rate of teen childbearing was at its lowest at 49 births for every 1,000. Throughout the decades, we have seen many trends in the decline of teen birth rates. Back in the 50s, it was more common for girls in their teens to get married. Once couples were married, it was expected and accepted for them to have children. Because it is now more uncommon for people to marry in their teen years, they are not expected to have children, and therefore this is not encouraging teens to become pregnant. Abortion is another trend contributing to declining rates of teen pregnancy. More teens may opt to get an abortion rather than giving birth. Of course, abortion is much more complicated, as in who has access to abortions, personal beliefs, and other contributing factors. The etiology or causes of teen pregnancy are not very complicated to understand. While teen pregnancy is seen across all races, places, and people, it is more common to occur in marginalized communities where poverty, lack of education, and lack of employment are experienced the most. In many places, girls are expected and pressured to marry at a young age and begin having children. In fact, in least developed countries, about 39% of girls marry before they are 18 years old and 12% marry before they are 15. In societies where women are not given much education or employment opportunities, motherhood is more valued. Lack of education is another factor that can increase the likelihood of teenage girls becoming pregnant. Many girls do not receive sex education. They are also never taught about contraceptives or how to practice safe sex. Even if girls know what contraceptives are, many do not know how to obtain them. Other barriers that keep girls from getting access to contraceptives include restrictive laws and policies, lack of willingness to acknowledge a teen's health needs, and a teen's inability to get contraceptives due to transportation, knowledge, or financial constraints. Lastly, sexual violence can cause a teenage girl to become pregnant. In fact, more than 1/3 of girls have reported that their first sexual encounter was forced. Signs and symptoms of teen pregnancy are missed or lighter than usual periods, breast tenderness, nausea, vomiting, feeling lightheaded, fainting, weight gain, feeling tired, and a swelling abdomen. The first trimester is from weeks 1 to 12. During this time, all of the signs and symptoms that were previously mentioned in the last slide begin to occur due to changes in hormones. This is also when people begin saying that they can see the pregnancy glow. During the second trimester, the mother's body is almost or fully adjusted to their changing hormones. However, they may start to feel pelvic pressure, more back pain, and a more visible baby bump will begin to show as the fetus grows. From weeks 28 to 40 is the third and final trimester of pregnancy. By this time, the baby is much bigger. The mother may experience more difficulty breathing because the baby has caused the uterus to push on the diaphragm. The mother may also have to use the restroom more frequently as the baby is pushing on her bladder. She may also feel more pain in her back, hips, and pelvis as they relax to prepare for delivery. Stretch marks and varicose veins may begin to appear as well. As the mother's body prepares for breastfeeding, she may experience leakage out of her breast called colostrum, which is a yellowish liquid. There are many predispositions that can increase the likelihood of a teen girl becoming pregnant. One of these predispositions is race. In 2017, the birth rate for Hispanic teens was 28.9 for every 1,000 births. The birth rate for non-Hispanic Black teens was 27.5 for every 1,000. These rates were 2 times higher than those of non-Hispanic white teens, which was 13.2 for every 1,000 births. However, the highest birth rate across all races and ethnicities was among American Indian or Alaskan Native teens. This birth rate was 32.9 for every 1,000 births. We see higher rates of teen pregnancies in the South and Southwest. From 2007 to 2015, the highest rates were in rural counties and the lowest were in urban counties. Socioeconomic status can also play a role. Some common contributors to teen pregnancy are low education and low income levels, lack of opportunities for youth involvement, neighborhood racial segregation, and income inequality. Teens who are in their child welfare system, such as foster care, are 2 times more likely to become pregnant. Being pregnant as a teenager increases many risks for girls. In fact, pregnancy and childbirth complications are the leading cause of death in girls 15 to 19 years old. Teen moms also have an increased risk of eclampsia, puerperal endometritis, and systemic infections. In addition, unsafe abortions contribute to maternal mortality, morbidity, and other long-lasting health issues. Among girls ages 15 to 19, about 3.9 million unsafe abortions are performed globally. In addition to health consequences, teen pregnancy also has many emotional and social effects. Because hormones drastically change when women are pregnant, teens experience this much more as their hormones are already naturally changing due to their development. Teens may also lose friends or be judged due to being pregnant. Girls who get pregnant in their teen years are more likely to experience violence in their relationship or marriage. Being pregnant and having a child as a teenager are 2 events that often cause girls to drop out of school. 50% of teen moms receive their high school diploma by the time they are 22 years old, compared with teens who did not have a baby, which is 90%. As previously discussed, some barriers to preventing and getting treatment for teen pregnancy are lack of education, lack of transportation, and inadequate access to resources. Lack of education is a large factor in teenage girls getting pregnant. They are either uneducated about sex, contraceptives, or both. Teens may also be too young to drive themselves somewhere, and they may not have anyone else who can or may not want to tell anyone else that they need their help. In addition, some teenagers just do not have enough access to buy the resources they need. This can include not having medical care, not having an education, being unable to obtain birth control, or many other possibilities. There are many different prevention measures that can be used to prevent teen pregnancy. First, sex education can help prevent teen pregnancy because teenagers will be educated on the risks, contraceptives, and reproductive health. This is the best form of prevention. Other prevention measures include birth control. There are several different kinds of birth controls, including the IUD, an implant, pills, shots, and patches. Over-the-counter birth control includes condoms, the birth control sponge, and the morning after pill. Before looking at the teen pregnancy statistics of the United States, I think it's important to look at a few demographics. Some of these demographics will help us think about the population's predisposition to teen pregnancy, and others are just interesting. To begin, the total population of the United States is over 330 million people. About 14.5% of the population are females aged 10 to 19 years old. About 75% of the population is white, 12% is African American or Black, and 4% is Asian. These are just some demographics that pertain to the race and ethnicity aspect of who is most likely to experience teen pregnancy. The fertility rate, meaning how many children women tend to have in the United States, is 1.8 live births per woman. The infant mortality rate is 5.5 infant deaths per 1,000 live births. The female life expectancy is 81.7 years old. 82.5% of the United States is considered to be urban. With all of these demographics in mind, the United States has the highest rate of teen pregnancy throughout all developed countries. Sex education in the United States varies between states. In 24 states, sex education is a requirement in public schools. 21 of those states require that it be taught along with HIV education. 33 states require that students be taught about HIV/AIDS. 20 states require that if sex and/or HIV education is provided to students, the information must be medically, factually, or technically accurate. 38 states require school districts to allow parents to be involved in sex education programs. 4 states require parental consent before the students are taught sex education. 35 states allow parents to opt out their children from receiving sex education. Some schools teach abstinence-only sex education, and others go more in depth, teaching all 16 topics that are recommended by the CDC. These topics are categorized into 4 different topics, which include HIV prevention, STD prevention, pregnancy prevention, and information on sexuality. Throughout the United States, teen pregnancy rates have been declining. Most pregnancies are seen in older teens who are 18 or 19 years old. Birth rates are also higher with African American and Hispanic teens. 77% of teen pregnancies are unplanned. In 2015, 61% of teen pregnancies ended in live birth, 15% ended in a miscarriage, and 25% ended in abortion. Today, about 2 to 3 of every 100 births have an adoption plan. In addition, abortion rates are also declining. As previously stated, complications from pregnancy and childbirth is the leading cause of death of teenage girls. In fact, low and middle income countries account for 99% of global maternal deaths. It is estimated that 70,000 teen mothers die every year as a result of childbirth. Many pregnant teens also lack the necessary prenatal care. This can be a result of not having the knowledge, the resources, or the support from family. However, prenatal care is very important for the health of the mothers and the babies, especially in the first few months of the pregnancy. Prenatal vitamins, for example, are essential in helping prevent certain birth defects. The current population of Niger is over 19 million people. Just some background information on this country. Slavery in Niger was only criminalized in 2003, but many people believe that about 43,000 people are still being held as slaves. In 2007, the country said that it was going to release all slaves, but they ended up backtracking on that statement, and it never ended up happening. The average amount of children per woman is 7.2. This is much more than what we see in the United States. This is obviously increases the population by quite a bit, but also has negative impacts on employment and education. Niger is also a very poor country and has high rates of unemployment. Majority of the working population of Niger only earns $1.90 in US dollars a day. It is very common for girls to stop going to school in Africa after primary school. Obviously, this means that they miss out on receiving sex education unless they are getting it from friends or family members. If girls are fortunate enough to continue in school, it is unlikely that they will receive any kind of sex education. There are 4 recommendations for improving sex education in Africa. These recommendations include using a comprehensive curriculum that provides accurate sexual health information, targeting young adolescents before they have sex for the first time, supporting teacher training to expand coverage of sex education, and helping adolescents stay in school. These are all very basic recommendations, but they are very important in a country who does not provide sex education to teenagers. The United Nations Population Fund created 11 husband schools in Niger. Men attend these husband schools twice a month to learn about reproductive health. This was an attempt to increase the likelihood of mothers surviving past childbirth. In some ways, this is a good thing, but it also goes to show the inequalities women face. The men have to go to learn about reproductive health, but the pregnant women have nowhere to go to learn or to get help. However, it has been reported that as a result of the husband schools, men have begun taking their wives to the health centers, which is another positive. Niger has the highest rate of teen pregnancies in the world, as well as the highest rates of child marriage in the world. 75% of girls are married before they turn 18, and 51% have had a child before they turned 18. As I mentioned earlier, marriage is a large factor in a teenager becoming pregnant. In countries that child marriage is common, it is also very common for them to have children at young ages. However, many of these pregnancies are actually intentional because they are married. This poses more risk for the mother and the baby. In addition, it also increases the teen's risk of domestic violence. Just from the information from the last slide, you would be correct to assume that maternal health is not great in this country. 1 in 187 women die during pregnancy, childbirth, or after delivery. Women and babies are denied health care because it is not covered and they cannot afford it. This puts both the mothers and the babies at increased risk of death. In addition, there are about 48,000 people in Niger who live with HIV/AIDS. As we know, this can be passed on to babies through the placenta, childbirth, or through breast milk. Without the proper health care, more women and children are at increased risk of this disease. To summarize this presentation, teen pregnancy is much more complicated than a teenager having sex and becoming pregnant. There are various factors that increase a teenager's likelihood of becoming pregnant. These factors range from race and ethnicity to sex education. Out of all developed countries, the United States has the highest rate of teenage pregnancies, although this rate is declining. Niger has the highest rates of teen pregnancy in the world. Pregnant teens also often lack the proper maternal care and prenatal care that is necessary to their health and their baby's health. This can be a result of not wanting to tell people, not having the proper resources, or not being able to afford it. Lastly, there are many prevention methods, but sex education is the best. Here are some of my resources. Thank you very much for watching my presentation.